Well, hello again. You are tuning in just in time to meet my cat. Her name is Nala. Say hi. Hi, everybody. Chris is going to take good care of you. Dr. Balsama, Sandy, Kathy, and everybody from Surgical Specialists of Washington Township will be taking good care of you. But I gotta let you go because I have a class to teach. All right, go ahead. All right, folks. Welcome back to Class 3. We will be discussing your post-op stages 3 and 4. In case you're tuning in to this video first, know that I am Chris Arolica. I am Dr. Balsama's certified bariatric nurse. You should have viewed stages 1 and 2 first, however. There are PowerPoints associated with these videos. So make sure you copy them out so you can read along with me as I talk. There are also post-tests after these videos. So take the test, see how you do. I will be posting an answer key on the webpage that these videos appear on, excuse me, as well. So if you're reading stages 3 and 4, hopefully maybe you're in stage 3 and 4 already, or your surgery is scheduled and you're very soon to have your surgery. Why is stages 3 and 4 important? Stage 4 is very important because that's going to be your stage for the entire rest of your life. So we do need to make sure that you know what you're doing with your diet after surgery. First off, we want to make sure you know what lean protein is, because without good lean protein, you're not going to be as successful with your weight loss. So nor will you be healthy. Lean protein, again, and I reiterate this almost in every presentation I have done, is soft lean protein. We'll start with that first. Ground chicken, ground turkey, of course, no skin, fish not fried, beans, low-fat, fat-free cheeses, egg substitutes like egg beaters or egg whites. Whole eggs are okay too, but they do have more calories and fat in them. Not everybody will recommend deli meats. I do, because I feel like I'm a realist, and healthy deli meats can play a role in your diet. So low sodium ham, turkey, chicken, roast beef. What's really nice in stage 3 is you can do lunch meat roll-ups. You can wrap them in lettuce leaves as well. Ground beef, but make sure you get the 93 to 96% fat-free. Soy products, because they're soft. Protein cooked in a crock pot also makes a soft lean protein. So stage 3, you only can eat soft lean protein. And remember too that it's called the fork tender stage. So if you can break the food apart with your fork, it's definitely a food that you can have, if it's a healthy food, that is. You may want to know this little equation, and it's just a very rough estimate, and that is 1 ounce of any meat, poultry, fish is about 7 grams of protein. So this fake piece of chicken, you can see how it fits in my hand. This is 3 ounces. So if 1 ounce is 7 grams, this 3 ounces is approximately 21 grams of protein. Now this piece of chicken, by the way, is not a stage 3 protein. It's hard and you have to cut it with a knife. It's not fork tender. So therefore, chicken like this is stage 4. So what's a sample meal in stage 3? So once you're going to be in stage 3, by the way, until you get back to see me after surgery. Your guidelines will say stage 3 lasts 2 weeks. I just find too many patients getting into trouble as they advance from stage 3 to stage 4. So I prefer you just stay in stage 3, even though it may be another week or 2. You'll be better off because of that. So a sample meal, a 1/4 cup of cooked scrambled eggs, could be a meal, or a 1/4 cup of soft green beans, a 1/4 cup of a lean beef stew. So that's about a half a cup of food. Or 2 ounces of flounder, 1 ounce of mashed potatoes, 1 ounce of carrots. So that's about a half a cup. The maximum amount of food you want to eat in one sitting is about a half a cup total volume. So you do need something to measure what a half a cup is. So this has graduated numbers on it. You can see the half a cup is about at that mark. This is an old sugar, no added sugar rice pudding container, similar to like a Diet Jello container. This is a half a cup or 4 ounces. So you don't want to exceed 4 ounces in stage 3. Remember the rules also in stage 3. These are rules you're going to continue to follow for the rest of your life. Never eat and drink together by the 30 minutes. We've discussed that in previous slides. That means 30 minutes prior, during, 30 minutes after a meal. No drinking. Chew your foods 20-25 times each. If you swallow a chunk of food you did not chew well after surgery, you're going to wind up bringing it back up because it's going to sit in your stomach like a ton of bricks. In your prior life, you had a full stomach and there was enough of a stomach to digest food. Now you have to start that process in your mouth. Soft, lean protein only in stage 3, where we will talk about stage 4 during this presentation also, and that can be a combination of soft, lean protein and harder proteins that require you're using a knife to cut it. Remember too that exercise or physical activity really has to be a staple of your life. Managing your nutrition is a good way to get the weight off. Exercise is the best way to keep it off. The combination of the two of them will assure your future success after bariatric surgery. Stage 3, we said already, lasts about 2 weeks according to the guidelines, but you're going to stay on them until you see me. You see Dr. Balsama 2 weeks after surgery. You see me 6 weeks after surgery, or Sandy. And anytime in between those visits or outside of those visits, you think you need to come in to see us, just call the office and make an appointment to do that. So just test your knowledge right now. How much protein is in 3 ounces of tuna? Well, it's a fish. 1 ounce is 7 grams. 7 times 3 is 21. How much protein in 2 egg whites? A large egg has about 7 grams of protein. 2 egg whites are equivalent to 1 whole egg, so it's about 7 grams of protein. How much protein in a 1/4 cup of low-fat cottage cheese? About 7. How much protein in a 1/2 cup of beans, kidney beans, black beans, red beans? That would be about 7 grams. How much protein is in about 5 ounces of chicken breast? Well, 5 times 7 is 35, so it's about 35 grams. And a 1/4 cup of egg beaters, that is also about 7 grams of protein. And on the slides, your answers are there for those questions that I just asked you. So in stage 3, this specific rules for stage 3, 2 to 4 ounces of food per meal, which is 1/4 of a cup to 1/2 a cup. And in stage 4, it's a 1/2 a cup to ultimately maybe a whole cup of food. At any of these stages, you may not be able to eat up to that amount. You can eat lower amounts if that's all you can tolerate, and we prefer that you do that. Remember to eat slowly, chew your foods really well, follow the 30-30 drinking rule. Remember too that alcohol is an empty calorie. It's not going to sit well on your freshly operated stomach, so you want to abstain from alcohol. And for the benefit of maximizing your weight loss in the first 6 months after surgery, because that's when you're going to lose the most weight, you want to abstain from alcohol 4 to 6 months. Make sure you toast all breads. You can definitely have a whole grain bread in stage 4. You can really have a toasted bread in stage 3, although I advise against it. Sometimes whole grain crackers sit better in the belly, and crackers are okay. So stage 3 kinds of foods: soft cooked veggies, raw vegetables are stage 4, soft fruit, potatoes, beans, chicken, tuna, egg salad with light mayonnaise or fat-free mayonnaise, chili, like turkey chili, that's a really good go-to food for stage 3. Stews, everything's falling apart and really, really soft. Stews tend to be really tolerated, as well as crock pot meals are too. Low-fat deli meat that we discussed already. Cereals that are higher in fiber and protein are going to be your better choice than something like cornflakes, which is just all carbs. And then any healthy food that you can break apart, again, that will be what you use to determine, is it a food you can actually eat on stage 3. So now we're going to talk about stage 4. Stage 4 isn't much different from stage 3. It's anything that requires a knife for you to cut it before you eat it, or anything that's hard. So a real well-cooked vegetable, stage 3. A raw vegetable would be stage 4. Most of your salad parts will be stage 4, like cucumbers, radishes, green peppers, onions, those things. Lettuce you could have in stage 3 if you break it up, and if you wanted to taste a little bit of salad, you could do, break the lettuce up, maybe a little light shredded cheese, maybe a little bit of egg in that, and light salad dressing. Will at least give you some taste of a salad in stage 3. But in stage 3, in stage 4, you can actually have a real salad. So what else is hard? An apple is hard, a pear is hard. You would need a knife you can't pull that apart with your fork. All raw vegetables are hard that are stage 4. If you have a piece of, if you cook an eye roast in the oven, that's stage 4. If you cook it in the crock pot, that's stage 3, because you have to cut a roast that was cooked in the oven. A piece of chicken like this is stage 4. A piece of lean steak like a sirloin, that would be stage 4. Sometimes it takes a while for people to get used to eating stage 4 foods. So that's why we do not want you rushing into stage 4. So sample meals for stage 4. A 1/4 cup of a sweet potato, 4 ounces of a chicken breast or thigh. Thighs sometimes are more tolerated because they're more moist, but it's still considered lean. And 3 ounces of broccoli. So that makes a meal. If you can eat that much, don't worry about it. We do want you to try to eat your protein first. And if you still have room, eat your veggie. If you don't have room, then you don't touch that sweet potato. Another example of a meal might be 5 ounces of pork tenderloin and 2 ounces of green beans. Or maybe a half sandwich that you use turkey breast, fat-free cheese, some light mayo, tomato, and lettuce, if you can even tolerate the half sandwich that way. But that would be an example of a stage 4, let's say lunch. Problem foods. You do want to avoid anything stringy, at least initially, like oranges, grapefruit, skin, seeds, broccoli stems. What's the name of that? It's that green vegetable. For the life of me, I can't remember. Celery. It's really stringy, so in the beginning, avoid that. Remember, no carbonation. Don't overcook any of your proteins, because the drier they are, that you are just not going to be able to get them down. Excuse me, they're going to feel like they're stuck right here. And remember, again, only moist protein are you allowed. If you find yourself eating too fast, use a toddler spoon or fork. Use the opposite hand to eat. That's definitely going to slow you down. Maybe use chopsticks if you're not used to eating with chopsticks. Eat with the opposite hand, I said, and only eat your meals at a dining room or kitchen table. Because you'll be totally focused on the meal, and you'll definitely be able to control what you're eating and enjoy what you're eating. Do not eat your meals in front of the TV, your iPhone, your laptop. When it's time to eat, it's time to eat, and you focus on your meal. So once you're in stage 4, what is our initial calorie recommendation? And this is just the initial, and you will stay on these numbers until, for whatever reason in the future, as you come back for your visits, we need to manipulate those numbers for you. So the diet is 1,000 to 1,200 calories a day, less than 35 grams of fat, less than about 60 to 80 grams of carbs. When you do come in for your 6-week visit with me or with Sandy, we will calculate your individual protein requirements. It's based on you individually, not the general recommendation that we make in your guidelines. You will also, by the way, need to have labs done for that 6-week visit. So Dr. Balsama will give you a lab slip when you see him at your 2-week visit, and you'll get that done about a week before you see me at 6 weeks. Okay, so how do you know how much fat something has? Well, of course, I am going to do another presentation on reading nutrition labels. So that's a nutrition label. And if you look, calories are at the top, then total fat, total carbs, and protein. So you're definitely going to find the information right there on the food label. Hydration remains important throughout the initial months right after surgery, but hydration is important for your entire life. Hydration is what lubricates the joints, it's what gets your bowels moving, it keeps your kidneys flowing, it plumps up wrinkled skin. It is the fuel to make your body work optimally. So make sure you drink enough. We can also calculate your individual hydration needs when we see you. But for now, we say, try to target about 2 quarts of fluid a day. And anything that is liquid, I count as a fluid. Not everybody does. Do limit your caffeine to 1 to 2 cups a day. Sometimes more caffeine than that can cause some heartburn or acid reflux, especially in somebody who has a sleeve gastrectomy. So sources of hydration then, anything less than 15 calories a serving. You do not want to drink calories. Crystal Light, vitamin water, zero water, diet Kool-Aid, flavored non-calorie water, decaf beverages, Gatorade Zero, G2 waters. You can even make your own fresh, artificial ingredient-free beverage by cutting up some fresh fruit, putting it in water and let it infuse throughout, giving you a very nice clean flavor, which is probably a really way to get some hydration in. Now with vitamins, you do have to take vitamins for life. It's important with both the sleeve and the gastric bypass. We do use a company called Nascobal, which is a prescription strength vitamin B12. And with that will be included all your vitamins, which is a multivitamin with iron or iron separately, a calcium citrate supplement. And the Nascobal is actually the B12 prescription strength B12. If you don't go with the Nascobal plan, then you will get from us what vitamins you can buy at your local store. There are many really nice bariatric companies who formulate vitamins specifically for absorption for our bariatric patients. There are so many companies, I can't remember the names of them all, but right now Bariatric Advantage is one, Fusion is another. We may have to order you some additional vitamins based on your blood work when your blood work comes back, which I do have to do that. So constipation is one of my biggest calls after surgery. People just can't go. And there's reasons for that. Number one, you're not getting much fiber in your diet initially. And number two, sometimes it's really hard to hydrate as much as you should. And if you're not moving around enough, that is also going to contribute to constipation as well. So fluids, physical activity, maybe starting to include some unprocessed bran in your diet, Switching your calcium citrate to a calcium magnesium citrate may help. If you're taking iron separately, if you're getting it from the Nascobal company or you're using a supplement that I have recommended, I never recommend a constipating form of iron. But if you've gotten iron on your own, I generally tell people to avoid ferrous sulfate because that can be irritating and constipating. So some constipating foods: banana, rice, cheese, peanut butter, potatoes. You may want to add a stool softener to help. A stool softener like Colace softens what's in there, so it does come out a little easier. But if you're really having an issue with constipation, you need to talk with me, and I will offer you some advice as how to handle that. Gas is another big complaint after surgery. What causes gas? Well, one big cause is swallowing air. How do you swallow air? You suck up through a straw. You could probably be swallowing air. Right now, I'm probably swallowing air because I'm talking a lot. So people who talk and eat at the same time, or people who eat and laugh a lot while they're eating, they tend to swallow air as well. Some fruits and vegetables can cause gas: broccoli, Brussels sprouts, whole grains, anything with an artificial sweetener that tends to end in OL, like sorbitol, can cause gassy problems. And if that's the case, then avoid that sweetener. If you're using some of these veggies, which you should because they're healthy veggies for you, taking Beano, which is another product that you can get over the counter at the first bite of your meal, can be very helpful. Gas-X can help treat it. An overgrowth of intestinal bacteria could happen. Sometimes that can happen too if you are put on antibiotics. So anytime people are put on antibiotics, I recommend that they at least eat yogurt every day, or start taking a probiotic by mouth. You can always ask your pharmacist what probiotic that he has in stock he would recommend for you. So treatment, we already talked a little bit about that. May need the probiotic, may stop drinking, you may have to stop drinking from a straw. Sometimes chewing gum, you're going to swallow air too. So if you're getting really gassy, maybe eliminate gum for a while. So Beano, we talked about. Gas-X, Lactaid, free milk may prevent some gas too. And I always like ginger tea. So issues after surgery. If you do something that your stomach does not like, there are some things that you can experience. Some of them are, and some of them don't even make sense, but these are years of patients reporting back to us things that they are feeling. So foaming or the spits or excessive salivation, you did something your belly didn't like. Getting the hiccups, you did something your belly didn't like. Belching, burping, getting a runny nose around eating time, sneezing around eating time, nausea, vomiting. All of those things happen because, number one, maybe you ate a little too fast. Number two, maybe you just took one bite too many. Maybe you ate and drank together. Maybe you just ate something that your belly didn't like. Maybe you didn't chew your foods well enough. So you always want to go back then and reflect, there you go, Nala. What did I do that maybe my stomach didn't like, and not do it again? Medications. When you're discharged from the hospital, the hospital will give you discharge instructions as to what medications you're continue or what medications you are to stop. Always call your family doctor, however, when you get home, because that advice often does need to change. So call your family doctor as soon as you get home. Initially, we do want everybody to avoid medications called NSAIDs like Celebrex, ibuprofen, Motrin, aspirin-containing products, sugar, alcohol-containing medications, Aleve. Tylenol is the safest thing that you can take. In the case of somebody who has had a sleeve, we do allow some of these medications. But initially, we like you to try to avoid them. If you've had a gastric bypass and somewhere down the pike you have a need to take an NSAID, make sure you call us so we can give you proper advice as to how to safely, temporarily take those kinds of medications. Now, with your protein shakes, you're going to continue with a protein shake until you at least see Sandy or me after surgery. So you're going to see us at your 6-week post-op visit. And we will assess at that time, should you continue your protein shake or not. Some people do. Some people just aren't breakfast eaters, and they're always going to have a protein shake for breakfast, and that's going to be okay. So they may become a staple of your life. Remember, it's always to eat your protein, though, instead of drinking your protein, because solid protein is going to stay in your stomach longer. Liquid protein, though providing your nutrition needs for protein, won't stay in your stomach as long. When you're sick, you get the flu, or for whatever reason, you're just not tolerating solid foods, always go back to your stages again. So go back to stage 1, stage 2, until you recover from whatever has made you ill. Whenever you're not eating enough protein, do use a protein shake. Whenever you know you are going to be skipping a meal, we don't want you to skip a meal. You'll never meet your protein requirements if you do. So make sure you have a protein handle. Because it's always best to have a protein shake than to completely miss a meal. After surgery, please continue support groups. A therapist I used to work with, as her thesis, she is a doctor now, her dissertation was on the comparison of patients who attended support groups and those who did not, and what were their long-term outcomes on weight loss maintenance. And guess what? The ones who attended support group by far did much better than those who did not. So a good reason to get to support groups. Repeat these videos as a refresher if you need them. Know that I will be posting other videos. One will definitely be on reading food labels. The other, as I put it together, will be on mindless eating, emotional eating, stress eating, nighttime eating. Those are all the reasons sometimes people don't do well with their weight loss after surgery. So it definitely deserves a presentation of its own. So our office will follow you for 5 years total. You'll see us at 2 weeks post-op, 6 weeks, 3 months, 6 months, 1 year, 18 months, and then every year for the next 4 years, we do need to follow you. So just that you know, you're going to feel some things you may not have expected. Your stomach will be noisy. Doesn't mean there's anything abnormal. You're going to hear it. It sits up a little higher. You may feel cold all the time. You're definitely losing some fat insulation. So that's a big complaint as well. You may get periods again if you're a female, even though your periods had stopped for months. A woman who thought she was in menopause may not be. Once she loses weight, she may regain her periods again. As women lose abdominal body fat, they do release estrogen, and so monthly bleeds start again. Your bottom may get sore, particularly if you're sitting too long on a hard surface, because you're definitely losing some fat padding from there. And also your emotions may be a little labile. And part of the reason for that is your hormones are all over the place after surgery. And it's for a woman, it may be kind of like going through the first trimester of pregnancy. But remember, that's temporary. Come to support, get support, use us, get support from us, and make sure you have plenty of love and family support at home as well. I do make myself available for all of my patients, and my phone number is 856-701-8668. You can call that, text it, email it. Any concerns, issues, problems you have, even when I'm not at work, as I'm not today, or I'm away, my phone is always with me. So take advantage of my accessibility for you. Okay, and that is it. So I thank you very much for joining me in class 3. Take that post test and stay tuned for class 4, which I hope to post very soon. Goodbye. So long. Much love. Remember, Dr. Balsama's philosophy of care is that you are family and we are to treat you that way. And we try our best to do that.